resistant germ. My specific purpose is to inform the audience about the germ we call MRSA. Methicillin Staphylococcus aureus can be a serious staph infection that enters the body in which it can travel throughout your body causing problems. I've read and heard about many different ways you can catch staph infection, but the one thing that I didn't realize was the many different ways the hospital tries to prevent this from happening until I myself have become a nurse there. Antibiotics have been a life-saving treatment for some infections except for this one, which is resistant to antibiotics. Now we will discuss the different causes, symptoms, signs, and treatments of MRSA. How can MRSA occur to people and who? Most staph infections are spread through skin-to-skin contact. Doctors, nurses, and other healthcare providers can carry germs on their body that can spread to our patients. These serious staph infections are more common in people with a weakened immune system, such as people who are in hospitals or long-term facilities, people who are in hemodialysis, people who receive cancer treatment or medications that weaken their immune system, people who inject themselves with illegal drugs, people who have had previous surgeries. It doesn't have to occur to people who have recently been in the hospital. It can also happen to people who are very healthy, because people can carry it on their skin, which can transmit to people who have recently had surgeries. If you don't wash your hands good, then when you walk in the room and you touch the patient, then you can spread it if you're a carrier. You may not think so, but it is very normal for healthy people to carry it on their skin. Sometimes you don't have any symptoms and it doesn't cause you any infection. Having no symptoms or not getting infected is called colonization. If you do, however, get injected or have symptoms, you can experience many different signs, such as red, swollen, painful areas of the skin. From those injected areas, you can also experience pus and fluid drainage. The occurrence of the symptoms usually take place if your skin has been cut or rubbed, which gives an entrance to MRSA. These areas of your skin that have hair are the most usual for the symptoms to occur. Patients in healthcare facilities who have MRSA have a more severe case. The infection could be in the bloodstream, the heart, or the lungs, or any other organ. Symptoms of these severe injections could include rash, chest pain, fatigue, wounds that don't heal, and shortness of breath. Some of the signs that will be taken from doctors to check. Doctors can order cultures, and that could include samples of wounds, sputum, or urine or blood. Samples are then sent to lab for testing, and it could take up to a couple days. When the doctors get the labs back is whenever they decide on what treatment to go for. Sometimes antibiotics, like I said, don't work because this infection has become resistant to antibiotics. Drainage of the infection is by now the only treatment if it has not spread quite yet. Infections in your lungs or blood are harder to treat. People who have weakened immune systems are also harder to treat. In conclusion, methicillin-resistant Staphylococcus aureus is a very hard to treat staph infection due to the fact that it has become resistant to antibiotics. If you happen to have signs, symptoms of such an infection, make sure you cover your wound if you have one and go to the doctor. There, your doctor will then run some tests and see which treatment you should receive, if you can receive any treatment. If you have a wound, you may need to cut it or drain it by, it may need to be cut or drained by the doctor. Don't do this at home. If it is a more difficult infection, meaning in your blood or your lungs, then you may be put on antibiotics for a long period of time, which is getting harder to treat. So antibiotics may not do you any good. Be certain to take precautions when it comes to you being in contact with patients when they have this infection or when you are carrying it. That's why when you're in a hospital, you see the little things on the door. If the patient has recently had or carries staph infection, then you have to gown and glove up. That's precautions that you must take in order to prevent this in the hospital.